Welcome to Dental XP. We're here in Naples, Florida, and I'm here with a very good friend of mine, a prosthodontic colleague, Tal Morr, who's been actually a person that I've been watching on the lecture circuit for quite some time now, and very, very impressed with his work. He comes with quite a pedigree, having graduated from Tufts in undergraduate dentistry and then going on to the University of Washington to do his prosthetic training, and he now practices in the South Florida area, which is sort of a hotbed of implant dentistry in the United States. He works with many, many gifted surgeons. He does a wide array of different prosthetic procedures, implants, as well as cosmetic dentistry. And I'd like to welcome you and also to get some information. What's exciting these days for you in your practice? What are you seeing on the horizon?
Exciting, I'd say the ceramics of today are very exciting. The technology today is very exciting. The fact that maybe in the future we won't have to pack cord anymore to take impressions. That's very exciting for me and for my patients. It would save me a lot of time and a lot of pain for the patients, so that's pretty exciting.
Fantastic. How do you see it evolving in terms of speed to getting it into clinical practice? Have you already started using some of these different protocols and ceramic systems yet?
I'm using a lot of zirconia ceramics. In terms of the technology of not taking impressions, I am one of those guys that likes to sit back and wait until it's perfected. And so at this point I'm just waiting, but I know that there are some systems out there which are already taking impressions of more than one unit. The idea is to get a virtual model of the whole arch would be ideal. Then you don't have to prep the teeth. you don't have to take the impression with cord or anything.
CAD/CAM technology of some kind.
CAD/CAM technology, absolutely.
It's fantastic. One of the things I've always noticed when I've watched you present, first of all, you take just beautiful documentation of your cases. The photography is beautiful. I know it's painstaking work, but I've also seen that you do a lot of your own lab work.
Yes.
A lot of dentists have either forgotten that art, it's hard to teach. What is it that you would tell a recent graduate who's coming out of school, whether it be restorative dentistry or prosthetic dentistry? What tips would you give somebody like that coming out and saying how they can do some of their own work to try to shape the tissue like you're going to be talking about in just a moment?
Well, I'll tell you, there's a tremendous advantage to doing your own wax-ups. One is you learn dental anatomy. By virtue of doing these wax-ups, it becomes second nature. You don't have to look at a reference to think about what a tooth looks like, what the anatomy, the occlusal anatomy, the occlusal relationships tend to be. And secondly, it teaches you so much about the case. It teaches you about how much you need to reduce, what is possible, what is not possible, how you have 100% more control over the case because you are the one evaluating the patient. You're the one who are visioning the aesthetic changes you want to make, and you have the ability to make the changes because you visualized what the changes were going to be. So I think it's a tremendous advantage. The problem is that it takes a lot of time to do these things, but in the beginning is when it takes a lot of time. As you progress, you learn that what the critical aspects of that wax-up are.
Getting a little bit faster, getting the information that you need. You know, obviously working in a predominantly prosthetic office myself and having an in-house laboratory, I've seen some of the work go on to the laboratory, but I've also seen some of the associates in my practice doing their own lab work. And I think you're absolutely right, although it takes a little bit more time, I think what they learn out of it is well worth it. One of the things that I would like to ask is the temporization phase. After the wax up, obviously temporary is so important. It serves as a blueprint. It also helps shape the tissue. And a lot of people have been hearing a lot of people on the lecture circuit talking about changing the contours. We're going to be hearing a little bit about that probably later on from Nitzan Bichacho today, about talking about that from an implant perspective, the actual body of the implant, the abutments of the implant subgingivally. How do you contour the temporary? Do you use acrylic? Are you using composites? How do you actually play with that contour chair side?
Well, I use two different materials. For my abutments, temporary abutments, I will use a composite because I can hit it with the light. I can bond it by sandblasting the metal and bonding it to that metal, and it maintains, it's less porous than acrylic, and it maintains integrity longer.
And what kind of composite are we talking about?
It doesn't matter. Any composite I find in my drawer.
Flowable or packable?
No, packable.
Okay.
It's very easy. And what I do is I finish it with a diamond wheel, a white diamond wheel. It trims very nicely and very smooth. And then on top of that, I happen to use acrylic. It doesn't matter what material you use. It's what works best in your hand. For me, acrylic, I've been using it since I graduated. I like it because it's flexible to a certain degree, so if you have any undercuts that you have not eliminated, you won't crack it. It's easy to repair. It's easy to reline. There aren't the issues of brutality of the material. So for me, acrylic works best in my hand.
And you do a salt and pepper technique chairside with hot water?
What I do is I will do my wax up. I'll make a matrix of that wax up. I will paint salt and pepper and make a shell and reline that in the mouth.
Fantastic. Let me, one more question, because I know you're going to be showing some of that and discussing some of that in your lecture coming up. One of the things that I always hear people ask me is, when you've worked so hard on the wax up and you work so hard on the temporary to shape the tissue, and we usually leave it in for about 3 or 4 months to get the tissue to really make its final changes, and when you want to transfer that information that you work so hard to the laboratory in a soft tissue model, what tricks do you use? Because I hear a lot of restorative dentists out there, and I'm sure there are many of them watching you right now that are going to say, well, I get the tissue where I want it, but then as soon as I take the abutments off to take my impression, the tissue starts collapsing. And what I send to my lab isn't what I actually had in the mouth. So how do you capture the shape of the soft tissue to send to the laboratory for a soft tissue model?
That's a good question, but there's many different techniques.
What do you use?
It depends on the day. Sometimes I will take my temporary abutment out immediately, put in my impression coping, and inject impression material all around it.
What kind of impression material do you use?
I happen to use, at this point, let me see, I've changed so many times, I'll use a Finis, or I will use, Ultradent has a brand new material which is excellent, okay. The light body. The other option is to have a temporary abutment, any temporary abutment that's going to, or a healing abutment that's going to maintain the tissue. You remove your temporary abutment, put it on an analog, take an impression of that, okay? And then you always have to have the healing abutment in the mouth so that the tissue doesn't collapse, and then you replace that and put your temporary abutment back. That's another option. Those are pretty much the 2 options that I use.
One of the things I sometimes hear, and I don't know whether or not this is good information to, especially somebody who's just starting out, but one of the things I sometimes hear is it good for you, do you always take an impression of your temporary when it's still in the mouth so that the lab has the temporary and soft tissue to see?
Always, always. That's the most critical part. That's how I predictably get tooth width, tooth length, occlusal scheme, occlusal plane, gingival heights, gingival contour, facial contour of the final teeth. My technician and I have a relationship in which he will copy everything that I ask him to, which is generally everything. If there are any minor changes, I will mention it. Otherwise, I will get almost exactly what I've given him in the provisional model. Without that, you have no information.
Well, you just saw somebody who has spent many years of training and has become really a star in prosthetic dentistry. He really does a lot of his own work. I've seen his beautiful presentations, and it's really been a pleasure to have him with us today. Before we let you go and go on to your presentation, which will be on sculpting and shaping of soft tissue, in particular around dental implants, 2 things that you will be talking about in the future, and you just mentioned just now. The shaping of the temporary chair side and the impression taking techniques. In the future, down the road, if you have small little videos that you can share with the audience, I'm sure that they would all be interested in your way of doing those 2 issues, because although it's great to hear it, to see it is even better for our audience. But we really thank you today, and we look forward to your presentation.
Thank you very much.